This past week, I had the opportunity to go to the Cornelius town meeting and speak on behalf of Novant Health and their request for approval to place an independent emergency room department, if you will, in Cornelius at the exit of 28 and 21, Highway 21. It was obvious from the beginning that the commissioners had already made up their minds and they were going to defeat it. And there was very little discussion about the importance of having that emergency room where they wanted to put it. So I'm going to switch over and play the recording of what I said and come back in the end in just a few minutes, and we'll go from there.
We'll open to the public. I have the same three questions. Like I said, capital investment, is it taxable? How many jobs associated? Private firm will own it. So yes, it's taxable, probably roughly 5 to 7 million. And then the number, sorry, run that in right now. Yeah. Other questions? Looks like we're good. Thank you. Thank you. Thank you. Thank you. And let's open it up now to the public. Lori, anyone signed up?
I have Dr. Kenneth Rethmeier.
Hello, doctor. Name and address for us. Thank you.
My name is Dr. Kenneth Rethmeier, 14906 Reese Finley Lane. And to mention, and I mentioned to the mayor, Jack Higgins, who was following me, has deferred his 4 minutes to me.
Very good.
Over the past 5 years, I have been privileged to be one of the volunteers at the medical center, and my specialty is focusing on veterans visits. I am a Navy veteran. I served 22 years as a Medical Service Corps officer in the United States Navy. My second tour was assigned as a preventive medicine officer for all the Marines in Vietnam. And I can tell you firsthand, Agent Orange is real. And every time I go in to visit, I encounter other Vietnam veterans like me whose lives are going to be cut short, and mine's coming very close, unfortunately, because of Agent Orange. And the issue there is continuity of care. And I'm going to come back to that issue that you raised, council member or commissioner, about continuity of care. When I got home, I finally retired as an 06 captain, fourth striper. I got involved as a part-time consultant working for the subsidiary of the Joint Commission that accredits hospitals. And over 7 years, I helped 35 hospitals prepare themselves for the Joint Commission process, which included a great deal of some of the things that Mike has already raised. And I want to give a shout out to Mr. Riley. He and his team have done a superb job in providing a very meaningful medical experience. I know firsthand, and I know from last week, very firsthand, how important that is. And I can tell you that what we're looking at, if you look at the population growth in this area, it far is exceeding the capabilities and capacities of the current emergency rooms that are available. And I'm going to come back to this issue in a short while. One of the key issues is making sure that if you go to an ER that's part of your system, Novant, for example, that when you're discharged, whether you're discharged to go home or you're admitted to the institution for care, the continuity of care that follows is absolutely critical. And for those people who don't normally visit Novant and go to Atrium, they want to make sure that their care is carried on and so forth. Now, part of the process that this hospital has gone through is called the Certificate of Need. It's a state law. It's part of the health plan for the state. It requires a series of researches in order to comply with a number of things. First off, is this item medically necessary? It could be equipment, it could be additional ORs, whatever. Secondly, is it going to be in the proximity of the population that needs those services most? If not, it's a problem. And then thirdly, what is the follow-on care that's going to happen as a result of the discharge of that individual? And I can tell you many years ago, getting involved with a national process and research project for the Robert Wood Johnson Foundation, we discovered that's a major issue. Now, let me fast forward the tape. Prior to coming back down to this area, I lived in Bermuda Run, North Carolina for 22 years. During that period of time, I testified on behalf of the other side, the atrium side, the Wake Forest Baptist Health, in support of the relocation and establishment of the Davie Medical Center in Bermuda Run. And we met all those criteria, just as Novant has for this independent standing emergency room service. During the course of the next 6 years, I served on the board, and I hate to tell you this, simultaneously as the mayor of the Town of Bermuda Run for 8 years. And I can guarantee you that everything we did as a town council, my town manager and I had talked about it today, was to make sure that the infrastructure and everything that Wake Forest Baptist Health needed to support that medical center was provided. Because the needs of the community that we were elected to serve were not being met properly in the old system. Fast forward to tape. I'm going to give a shout out to that hospital. Last year, it was rated the highest performing hospital in the atrium system, Davie Medical Center. Secondly, Fortune magazine published a research project. It was ranked 7th in the nation of small community hospitals. So I can guarantee you that if the town is supporting the medical system, it will come back in benefits for everybody, and especially the patients. So let me come back down this way. I look at what I see. Every time I go to the hospital, I make a round, as I used to do when I was on active duty, our naval hospitals. And if you go to the ER, the demand for those services is exceeding the capacity, and the waiting times are excessive. Not because of the fault of the hospital. It's access to the care. And so this project will be in a location that will provide access to that care. And by the way, if you do get transferred down for admission, you don't have to wait in traffic because the ambulance can turn the light and sirens on and you make it. And the vast majority of the patients that will come in will be walking in on their own saying, I need help. And I can guarantee you they're looking for the best. Novant is ready, willing, and able to do what is necessary. And as I think about the future and look at all the projects that are on your books, expanding the population of this area, it's excessive. So we've got to make sure that the medical care services are ready. And Novant's standing there saying, we're ready. We're going to do it. Now, a few years ago, I'm going to close with a comment. I published a book on healthcare leadership, Leading for Value, transforming field-tested thinking and tools into inspired healthcare leadership. That was after 50 some odd years in the business, and I'm still doing work with Maastricht University in the Netherlands. And I can tell you that the byline of that book is very simple. As leaders, our role is to deliver value on target, on time, every time, without fail. I guarantee you, this is your opportunity to do just that. If you don't, you and this community will suffer the consequences of not having adequate care available when it's needed, and it will cost lives. Thank you very much.
Thank you, Doctor. Appreciate your comments and appreciate your service.
Mayor, can I ask the
That's what I said, and I stand by it today. Cornelius has an opportunity, and at this point, they blew it. It's a shame. Leadership calls on people to do the right thing at the right time. And I only wish that the leaders of Cornelius would have done that this past week. I'm going to stop now. I'd be interested in any comments or feedback you have about what I said and what I believe. Thank you very much.